Dr. White. Welcome to the Theories of Addiction and Pharmacology. I want to just start off by kind of getting into what this class is going to entail for you and just give you a brief overview. So there's usually two perspectives when students come to this class, and one is students have oftentimes worked in addictions for a long time. Maybe they're in recovery, so they come in thinking it's going to be an easy A, and they already know a lot of the information. Then on the other hand, there's students who have no experience in addiction, might have some addiction trauma, and they come in kind of nervous about starting behind the eight ball type deal. And I will say it's a different experience for both of those groups. Both of those groups tend to kind of approach the class differently, and that's completely okay. So I will say, for the people who have experience, if you work in addiction, etc., this is going to be an opportunity for you to really expand and challenge the beliefs and experiences that you have had in your recovery or in your current or past work positions. I know a lot of places might work off models, that were developed, let's say 30 or 40 years ago. And I'm going to challenge students to really get in the research and talk about what is happening today. What is the research showing today? Not just what worked for you or what works at your agency, but what are the new things coming up? So that is going to challenge people who've always worked in the field to really think outside of that box a little bit and be open to new ways of thinking. People coming in with no experience, that's completely fine as well, because you're in the right place. You wouldn't need to be here if you didn't need to learn something, and we learn something new all the time. So the good thing about that is that you're starting with a fresh set of eyes, and you don't have to relearn something or reprogram yourself to think in a different manner. So this class, I will say, some people who don't have a lot of experience tend to want this class to be something that, like, 1 week on marijuana and 1 week on stimulants, etc. We don't have a lot of that in this class, so if you don't have a lot of exposure and you need some background on the different substances, I do recommend kind of going on the side and getting that information. Because what this class is going to be more about is talking about addiction theory, talking about counseling theory, and how those relate to addiction. We're also going to cover, obviously, process addictions, which is like gambling, but we'll talk about some of the others that might come up in future DSMs. We're going to talk about, how do I assess? Okay, a client shows up. How do I know if they're just a recreational user or if this is diagnosable? We're going to definitely dive into that. We're also going to talk about different, like I said, theories, but also techniques like motivational interviewing. And so this class is more about, how am I going to apply my counseling techniques, skills, and awareness to work with clients who have addiction disorders, not necessarily learning about each individual substance. So I do want to give you that little pre-warning. But I love to teach the class. I teach it every term. I've been teaching it for a very long time. I've worked in addictions for a long time as well. And I hope that you love it, but I also hope that you're open to constructive feedback, because I do provide a lot of feedback, especially challenging you to think deeper, think harder, think more broad about this topic, to support your beliefs, to support your experiences with current research. That's something that I think is very important, that we don't get caught in the tradition of things, but rather are doing things that are supported by research. One, it's ethical. Two, it's going to stop us from having practices or procedures that are outdated, those sorts of things. So hopefully everyone's open to constructive feedback, and I encourage you to make sure you read through the syllabus. You have an assignment each week. We'll have discussions, we'll have papers, we'll have a movie. There's lots of different assignments so that we can look at things in different ways. There'll be a case study. So look through the syllabus, look through each week in the Blackboard. On the modules on the left-hand side, it'll say week 1, 2, 3, and it'll tell you what's due, etc. Which you kind of know most of that from your other courses. But if you have any questions, always reach out. My email is whitem@lindsay.edu. I look forward to working with y'all. Bye.